迎大家出席今日。
Welcome to the press briefing. We have Dr. Albert Au, Principal Medical and Health Officer of the Centre for Health Protection, and Dr. Sarah Ho, Chief Manager of the Hospital Authority. First, Dr. Au will give you an update on cases. Friends of the media, members of the public, good afternoon. Today, I'm going to report the number of cases and the latest information as at the 10th of March. Yesterday, for PCR positive cases, 18,888. Case number 575,630 to 594,517. Of these 18,888 cases, 2,284 cases confirmed through the Hospital Authority, 2,513 cases are confirmed through the Public Health Laboratory Service. And for the remaining 14,091 cases, they're confirmed through private laboratories. And of these confirmed cases, 4 are imported cases. For the remaining 18,884 PCR positive cases, they are local cases. On DNA analysis, yesterday the Public Health Laboratory Service conducted data analysis on 2,513 specimens. No specimens were found to contain the L452R strain, and 1,704 specimens tested negative for L452R. That means they are Omicron cases. And for the remaining 809 cases, we're still doing an analysis, and in some specimens, there's not enough viral load. For rapid antigen test results, in the past 24 hours, or in the 20 hours since yesterday, there are 10,493 reported positive cases. And together with PCR cases, there are a total of 29,381 cases. Now, as I mentioned, 18,888 cases are PCR positive, and then 10,493 are RAT positive. In the cumulative total in the fifth wave is 634,169 confirmed cases. For residential care homes, yesterday, an additional 13 homes have seen either cases or outbreaks. There are 9 residential care homes for the elderly and 4 for the disabled. There are a total of 295 cases. 262 are home residents, and the remaining 33 are staff members. For the fifth wave, in total, 731 residential care homes for the elderly have seen cases. That's 91% of the total number of homes. And in the past 2 weeks, there are 410 homes with outbreaks. That's 51% of the total number of homes. For all RCHEs, there are a total of 23,400 residents who've been infected. That's 31% of the total number of residents. And 6,100 staff members have been infected. That's 20.64% of all staff members at these homes. And for residential care homes for the disabled, there are 253 homes that have seen infections or outbreaks. That's 75% of the total number of homes for the disabled. In the past 2 weeks, there are 164 homes with outbreaks or infections. That accounts for 49% of all homes for the disabled. And there are about 6,380 residents infected. That's 35% of all the home residents. And then 2,350 staff members have been infected. That's about 22% of all the staff members at homes for the disabled. On death cases, there are now 1,893 death cases for involving home residents. 1,887 death cases involved homes for the elderly, and 6 cases involved homes for the disabled. For the latest death figures in the fifth wave, there are a total of 3,231 death cases. the death rate is 0.51%. And that's 1,813 males and 1,124 females. Age is between 11 months and 122 years old. The median age is 85. And there are still 5 cases of death involving children. And for the age group 18 to 59, the number of death cases has increased to 144. That's 4.46% of the total number of death cases. And most of the death cases involved those aged 60 or above, 3,078 cases in total, and that's 95.9% of all the death cases. And then 2,247 cases involve elderly aged 80 or above. That's 69.5% of all the death cases. On vaccination, the latest analysis of the Center for Health Protection is that among the death cases, 90.7% of the deceased have not been vaccinated or have not completed vaccination. And those aged 80 or above that are deceased, the 92.5% of them were not vaccinated or have not completed vaccination. And for all death cases, the fatality rate is 1.84% for those who have not been vaccinated or who have not completed vaccination. And compared to those who've had 2 doses of vaccine, the fatality rate is only 0.07%, so that's 26 times of difference. For elderly aged 80 or above who have not been vaccinated or have not completed vaccination, the fatality rate is 11.7%. Compared to elderly aged 80 or above who've had 2 doses of vaccine, the fatality rate is 2.55%, so the difference is 5 times. Dr. Sarah Ho will give you an update on hospital authority cases. There are 9,760 confirmed cases and preliminary positive cases staying at public hospitals: North Lantau Hospital, Hong Kong Infection Control Center, Hospital Authority Infectious Disease Center, and the AWE Community Treatments Facility. Last night, we reported 79 patients in critical condition, 122 patients in serious condition, 76 critical patients are now in ICUs. As at 0 hours today, in the past 24 hours, a total of 196 patients who tested positive for COVID-19 passed away. 127 males and 69 females, age between 24 and 107 years old. Among the patients who passed away yesterday, 113 came from residential care homes. 148 of the deceased did not have any record of vaccination. 30 of the deceased had 1 dose, 12 had 2 doses, and 1 had 1 dose, 3 doses. 185 of the deceased are elderly, aged 65 or above. And then there are a few relatively younger persons who passed away. One is a 24-year-old male. He has some genetic disease. He lived in a home. He vomited once, and then he had seizures, and then he tested positive at the Accident and Emergency Department, and then his condition deteriorated rapidly. On the 10th of March, he passed away. There's another 50-year-old female, and then a 52-year-old male, 57-year-old male, 58-year-old male, and 59-year-old male. For these 5 persons who passed away, they all lived in homes. So many of them had chronic diseases, or they were bedridden and they required constant care. And one required renal dialysis. So and then there is a backlog of some figures that we have to report today. Between the 28th of February to the 9th of March, 98 patients passed away, but they were not reported yet. 59 male and 39 female, age between 34 and 100 years old. In the past one day, 877 patients recovered and were discharged. About 80 patients tested positive upon admission. 120 odd patients in the same wards would be listed as close contact. For our staff members, so far 13,311 staff members are confirmed cases. 5,786 staff members have returned to work. For the Queen Elizabeth Hospital, I'd like to report to you on the progress of transforming the QEH into a designated COVID hospital. Now, half of the patients that need to be transferred have been arranged for transfer, and we will transfer some patients to private hospitals if the situation allows. Now, the QH is turned into a designated COVID hospital is mainly for the main block, for day care, day center or block T, that is the specialist outpatient clinic, and then day services, and also the Jockey Club radiology block, that's block R, and also clinical tumor section, and also all the chemotherapy sessions, as well as the daytime Chinese medicine clinic. They will continue to provide service, and if there are any changes in the arrangement, we'll inform the affected patients as soon as possible. Now, you may have seen some photos circulated on social media about the way we kept the bodies of the deceased. Well, actually, we've gone through those photos. Some were from before, and we have actually dealt with those cases. In the past week, for patients who tested positive and who had complications and then passed away, there's a substantial increase in such numbers. So that's heavy pressure on public mortuaries. Now, there are some bodies waiting to be transferred to the Department of Health's public mortuary, but then certain statutory processes have to be completed, and these bodies therefore remain in the hospital's mortuary, and that adds to our pressure. We have actually used up all the spaces in the hospital mortuary for keeping bodies, and that's why we have made arrangement to provide temporary storage facilities. After a patient passes away in the ward, healthcare medical staff have to go through established procedure to handle the bodies, and then these bodies have to be moved to the hospital's mortuary for storage as soon as possible. Now, for some of the bodies, we know that we have not been able to move them from the wards to the mortuary, and it may cause some concerns among some patients. And then when we transfer bodies from the ward to the mortuary, we would certainly go by the principle of showing respect to the deceased. We also consider the sentiments of other ward patients and staff members. But then we are under immense pressure, which is unprecedented. We are experiencing great difficulty, so we ask for understanding that we are trying our very best to provide more manpower to deal with this situation, and we ask for understanding from the patients. The hospital authority will continue to keep in communication with family members of the deceased and also the funeral service sector. We hope that bodies will be collected by family members and funeral parlors as soon as possible, so that funeral services could be arranged and at the same time free up spaces in public mortuaries. The hospital authority will continue to work with the Food and Health Bureau, Department of Health and other relevant departments. We will step up communication so that we could speed up the transfer of bodies to public mortuaries. Thank you.
We will now take questions. Please raise your hands and speak with our microphone, and please identify your media organization. The lady in the front. Hi, I'm from Phoenix TV. Just now, according to the doctor's report, today we have some 18,000 additional cases from PCR and another 10,000 cases from RAT. We can see that for the first time since the peak, the number tested positive on PCR has lowered to below 20,000. So is that a watershed point? So can you give us an explanation about the trend? Can we say that the fifth wave has been put gradually under control? About the trend of the epidemic, we have seen that there are some signs that the epidemic is gradually coming under control without an exponential increase. However, we cannot conclude the trend with 1 or 2 days figures. We have to wait a little longer, maybe 1 or 2 weeks. Looking back at the figures in the past 2 weeks, we haven't seen an exponential increase. It seems that the figures have stabilized. However, for the past week, the number of daily cases maintained at 30,000 to 50,000 cases. Compared with the end of February and early March, every day we had an exponential increase. The situation seems to have stabilized. Still, there is no sign yet that the number is climbing down. We have to keep observing. Of course, comparing with early March, the number is smaller. However, the situation is still very serious. Every day we have more than 30,000 new cases. It shows that there are still numerous transmission chains in the community. From RTD operations, we can see that for some buildings, the positive rates was as high as 20%, 10%, or even 20%. It shows that we still have a lot of hotspots in Hong Kong with active community spread. The public should remain vigilant and implement all precautionary measures and practice social distancing. If we let up, then we may see a rebound. Next question, the gentleman over there. Good afternoon. I'm from Now TV. Now about the situation of dead bodies. So are you admitting that what we saw is real? That happened previously in a hospital. Which hospital was that? And would you apologize to the affected family members and patients? And about isolation orders. Some patients are reported positive RAT. However, the RAT was in place, and they went downstairs and were tested positive again, and then they were sent to isolation facilities, and they got a second isolation order. So is that really necessary for the patients to get tested again downstairs, and can they still choose to isolate at home? Which department is responsible for enforcing the isolation orders? Why are there conflicting instructions issued by the staff? Yesterday, Dr. Au said it seems that the situation has peaked. So from the expert perspective, do you think that it is still necessary to build isolation facilities? About the situation of the bodies, I would invite Dr. Sarah Ho to supplement. there are photos circulating online that there were bodies remaining in rooms. We have asked the hospitals, and we gathered that those photographs were showing situation previously. Now the situation has improved. As we said, the hospital authority is facing unprecedented blood pressure. The situation hit us very quickly and hard, and the staff have been under huge pressure, and we apologize for causing distress to patients. It is also very tough on our staff, so please understand. Understand the situation. About RTD, if a resident is living in a building under an RTD, and if he or she is tested positive on PCR, then the patient would be subject to isolation at home pending admission to isolation facilities. Normally, an additional PCR test is not necessary. However, there are many special circumstances. I cannot address each and every one of them. The principle is if the patient's test result is confirmed by the CHP and then an isolation order has been issued, then the patient just have to stay home without getting another test. During a RTD, if a resident is tested positive on PCR, then the on-site colleagues would perform a risk assessment and issue an isolation order and arrange for admission to isolation facility as soon as possible. With the number of cases in a building under lockdown, priority would be given to the patients. Now, when a new isolation order is issued, the period will still, the clock will still start counting from day 0. That is when the patient is tested positive. Now, it seems that in case number is lower than early March. However, we still have more than 30,000 new cases each day. So many patients still need to check into isolation facilities, and we expect that there will be more cases coming. That's why we still need to construct more facilities to isolate them. The lady at the back. Thank you. I'm from Cable News. You said, you mentioned the photos circulating online, and you have asked the hospitals. So which hospital was it? And where inside the hospital was that? Did that only happen at one hospital or at many hospitals? Can you give us the name? And Dr. Ho said the bodies were stored at a temporary storage place. So what kind of place is that? And now some hospitals are converted into a COVID hospital. Now, what about the waiting time for at A&ED and other wards in the Kowloon Central cluster? What is the additional waiting time? Now, about the delivery of the oral medicine, how much was procured, and which groups will be given priority? Now, according to the HKU's study, hamsters were the host. It may cause a change of the virus. So what will happen? So what about the confirmatory test for the cases reported online? Dr. Au said PCR tests will be performed. So do we have the results today? How many false reports were discovered? Thank you.
Perhaps I'll give an answer first. The bodies of the deceased, where we face immense pressure. So within the hospital, at outdoor areas, we keep temporary storage facilities, refrigerated containers to be exact, for the storage or proper storage of bodies. About the oral medication, we followed the advice of experts, and we have procured a suitable quantity of oral medication for treating COVID-19. There are two. One is the MSD drug. We started administering that. The other drug is from Pfizer. It will arrive at Hong Kong next week. We will follow clinical protocol and guidelines, and if we will administer drugs where appropriate. And later on, for patients with the right condition, we will prescribe these oral medication too in outpatient clinics, and then we'll follow the clinical guidelines and the condition of the patients in prescribing these medical medications. For the Queen Elizabeth Hospital, some of the patients will be transferred to other hospitals. As for the waiting time at the accident and emergency departments, we will be watching that closely. There will be triaging. For urgent or critical cases, they will have priority. About the study on hamsters, from at the end of December to about early January, when we conducted epidemiological studies, we found a batch of hamsters imported from overseas that carried the virus, and so some of members of the public were infected with the Delta variant, that is L452R variant. The Center for Health Protection and the Agriculture, Fisheries and Conservation Department carried out in-depth study. We went to retail shops that were visited by patients. We also went to the go down for the hamsters. We collected environmental samples from the warehouse and the retail outlets, and then we found the Delta strain in these samples. And then we find that the genetic sequence of these environmental samples similar to those in humans. So there's a possibility that there is cross-infection from hamsters to human beings, and so there's evidence to show that this is the case. At the time there was an outbreak, the AFECD immediately took action to stop the importation of hamsters. The department will closely monitor the situation and will take appropriate measures. Yes. For the fifth wave of outbreak in Hong Kong, we have so far 726 cases with the Delta strain. But then in recent days, in the past week, when we do genetic analysis on specimens, we no longer find the L452R strain, 452R strain or the Delta strain in these samples. Now, we have launched the online platform for reporting positive RAT results. We encourage the public to report positive results to us so we could get an accurate picture of the latest number of cases. And then we could carry out prevention and control measures such as issuing isolation orders to the infected person or deliver RAT packs and so on to the patients. And then we will do random checks on a certain percentage of such reports, and then contractors will send them a specimen collection pack so that we could conduct PCR tests. This is a standing arrangement. If someone is selected, the person will receive a phone call from us and we ask for his or her cooperation. I'm not at liberty to divulge that. Here, the gentleman here. I'm from TVB. First, if I may ask Dr. Oh, the online registration of RAT test results has been launched for some time. You are encourage the public to report the cases so you could get a better picture of the number of cases. But then more people are using RATs and there are fewer people taking the PCR test. Are you worried that members of the public may just do the RAT test? If they test positive, they just choose to stay at home and recuperate? So maybe that's not the real picture with the figures you present. Now, a question for the hospital authority. How many refrigerated containers have you set up at public hospitals for the storage of bodies? And another question is on oral medication. You say that you have distributed the MSD drug. So how many patients have been administered with this drug? As for the Pfizer delivery, what is the quantity? Is that enough to cope with the so many cases in Hong Kong? And do you have any data that if people take this oral medication, how much the treatment period could be shortened? And if there's enough quantity of oral medication, would you then distribute the medication to all infected persons, just in case? For PCR test and RAT test, they could accurately identify cases. If people have symptoms or they are in high-risk groups or there are someone close to them that tests positive, we encourage people to take the test as soon as possible. And if they test positive, they should go home and isolate themselves so that they won't spread the disease in the community. So that's why we encourage the public to take the test as far as possible. Now we have limited PCR testing capacity, and there are too many patients. And we know that for some, it's difficult for them to get the PCR test. That's why starting from the 26th of February, we want to make better use of our PCR testing capacity. So we therefore decided that our ATE test results will be recognized if the public use properly certified RAT, so they could also get an accurate result. PCR test, of course, is also useful. It's more accurate than RAT. That's why we have parallel reporting mechanisms for RAT and PCR. Now we have community testing stations, and there are many clinics that use PCR to confirm cases, and these results will be reported to us. If the public test positive with RAT on their own, we encourage them to report the cases to us, so we could therefore follow the trends using both the different tests. Now, on which hospitals have temporary storage facilities, well, if necessary, we will try to arrange the setting up of refrigerated containers as far as possible so that the bodies of the deceased could be kept there properly. On oral medication, we have only just introduced the oral medication, so we'll be watching closely the usage and the quantity of such medication being used. From overseas data, we can see that the oral medication could reduce the fatality rate as well as the need for a hospital admission. Now, we are watching the use of such medication closely. They are, of course, antiviral drugs, and then we have to see how patients respond to the drugs, and we have to look at all the data. So it's too early to say whether we should give the drugs to everyone so they could keep it for when they need it. That's not yet the arrangement. I'm from News. I have 3 questions. 1, the vaccination rate in Hong Kong has reached 90%, but there are still a large number of people who become infected after vaccinated. So do we have full immunity barrier now? And then there are some people who pass away at home. So on early identification and early isolation treatment, do you have any screening criteria? The third question. There are 5 quarantine facilities with 815 units, but as at noon yesterday, only 22 people are in these facilities, so that's a vacancy rate of over 90%. So what is the reason for that? What about close contacts? Under what circumstances would they have to go to quarantine facilities? Thank you. I'll answer in Cantonese. On vaccination, there's a body of scientific evidence to show that after the administration of 2 and 3 doses, there's effective prevention against infection. And if there's infection, is effective means to prevent complications or death. That's the case for both vaccines, BioNTech and CoronaVac. So the effective rate is some 80–90%. And our data shows that too. In cases where people have had 2 doses of vaccine, the fatality rate is very different than that for those who've not been vaccinated or who've had just 1 dose of vaccine. So it shows that vaccine is very effective in first preventing infection, and if there's infection, it's useful in preventing complications and so on. So that's why people should get vaccinated as soon as possible, and they should complete all the doses of vaccine. Omicron is highly transmissible virus, and there are cases where people have no or mild symptoms. So that's why people could get infected very easily. Now, so individuals in particular, the high-risk groups such as the elderly and children, they should get vaccinated as soon as possible. On quarantine arrangement, now before we arranged for close contacts to move into quarantine centers, but now we have a severe epidemic. Many close contacts are household members. We now have a stay-home safe scheme. Now, if there are cases in a household, usually you will arrange for the household contacts to be quarantined at home. So there's why a lesser need for quarantine facilities. The government will watch very closely the occupancy rate at quarantine centers, and we may turn some of the quarantine centers into community isolation centers. An English question, perhaps?
A few questions from the SCMP. So Dr. Ho said that the photo showing patients staying in the same room with several dead bodies was taken earlier. Exactly when and where was the photo taken? And can you also give us an update on children currently in critical condition? So there are 2 under the age of 12 and 1 between the age of 12 and 19. And the last question is, Health Secretary Sophia Chan said DH has stopped giving out electronic wristbands to people under home isolation, as some people had difficulties wearing the wristbands. Can you explain which group of people she was referring to, and what kinds of difficulties do they face? Thank you.
For the photos that we observed circulate in the media, and it was taken a few weeks ago or few days ago, and I know the situations has been rectified. We have increased manpower to try to help out the situation, and also we have set up some temporary stations within the hospital premises to store the dead body. And concerning the critical cases of the pediatric case, I don't have the data on hand.
For the electronic wristband, I think the other government officials has made announcements in press conferences, and I have no other supplement here.
Next question, the lady over there. Good afternoon, I'm Ming Pao Daily. Now, Dr. Ho, for doctors at ANAED, can they not prescribe antiviral medicines, be it oral medicines or injections? So at what stage will they be prescribed these medicine? Do we have to wait until they are admitted to wards? These medication is not prescribed at ANAED, so does that have to do with the high mortality rate of elderly people? You said the MSD medicine is being prescribed. So can you tell us the clinical guidelines for the drug? What clinical condition or what kind of patients would be prescribed with that drug? Now, Dr. Au, so can you tell us the number of samples collected at community testing centers and the positive rate? And you mentioned Delta variants in the fifth wave. Can you tell us the ratio of Delta and Omicron cases, as well as the fatality ratio during the fifth wave? On the treatment course for COVID patients, if the condition warrants it, we will perform a triage. If the patient's condition requires admission, then the clinical doctors would follow up on the situation. There are clinical guidelines in place for the drugs, and also there are contraindications for the drugs. And there are also side effects of the drug. For patients with reduced renal functions, then we cannot prescribe the drug to him, and also it may affect the production of enzymes of the liver. So our IB team, that is the infection control team, would assess the situation before prescribing the drug. For the detailed guideline, I will give you a supplement later. At present, we are collating the figures about the death cases, where we are aware that some of the patients, diseased patients, were chronically ill and had multiple illnesses. So when they caught COVID-19, as shown by data globally, their mortality rates would be higher than younger patients. About the community testing centers, in the past week, every day we are dealing with some 120,000 samples. Some of these samples would be tested at private laboratories. The positive ratio is about 18 to 19%. It shows us that the positive ratio is still high, especially for RTD operations. Some 10 to 15% of the samples would return positive. For a breakdown between Delta and Omicron, in the fifth wave, we have 726 Delta cases. Almost all the remaining cases are Omicron cases. Since mid-January, the cases were mainly caused by Omicron BA.2 strain. So among the some 500,000 cases in the fifth wave, almost all of them are Omicron cases. For Delta cases, they were caused by hamsters in mid-January, which caused community outbreak. and also we saw a Delta spread in some buildings. So it seems that at present, the Delta variant has been put under control in Hong Kong. However, the fatality rate for Delta is higher than Omicron, as shown by medical journals. Our public services laboratory would perform a genome sequencing for death cases to find out the strain. Some 140 cases, we have performed genome sequencing for some 140 cases. For some cases, the viral load is too low to perform a test. We have found some 60 death cases resulting from Delta. So it seems that most of the cases are Omicron in Hong Kong. And the fatality rates for Delta patients is much higher than that of Omicron patients. Sorry, the speaker is not coming through the mic. Around the same, the figure remained at 18 to 19. The lady at the back, I'm from Independent in media. We learned that one middle-aged man who took Lianhua Qingwen medicine, and then he approached an AED because of sickness, and then he had a liver replacement. Is it because of chronic illness? Was his acute liver failure caused by Lianhua Qingwen? How many pills did he take? Did he test positive on admission? And also, would you direct all the general outpatient clinic to suspend prescribing Lianhua Qingwen pills to patients? Depending on the individual condition of the patients, we would prescribe different proprietary Chinese medicine to patients. For the safety of the patients, before taking medicine, you should consult a Chinese medicine practitioners and refer to the guidance. Now we have set up a hotline that is 1-833-4511. It operates 7 days a week from 9 to 7 each day. We have Chinese medicine practitioners who will take questions. This is the end of the media briefing. Thank you very much.